Hi, you guys. Welcome and thank you so much for joining Breastfeeding and Cannabis workshop hosted by none other than me, Shanitria, your host. And I am joined by a super dope panel. Today, we're going to be chatting about all things pregnancy and cannabis, which is like y'all's favorite topic and mine. And I can't wait to jump into it. So, what we're going to be doing today is we're going to have a panel discussion about pregnancy and cannabis and a few select topics based on just frequently asked questions that you guys always have about it. And that is totally understandable. I know a lot of people do not talk about pregnancy and cannabis and how it's helpful. And there's so many questions around it. There's not a lot of research. But there are plenty of people who have experienced the health benefits of this plant themselves. And we also will be joined by virtually by Sandra the Kushners, and she will be here via a pre-recorded video where she will be answering questions that were submitted to her that are basically just frequently asked questions about pregnancy and cannabis. So we're going to start off with that. Before we hop into that, I just want to remind you guys to please make sure you're muted when you enter the meeting or the workshop and stay muted until we get into the Q&A portion. A number of you guys did submit questions in advance using the Google form, and I appreciate that. Thank you. So when we do the Q&A, we will start with those questions that were already previously submitted, and then we will jump into questions from the chat. I am committed to answering as many of y'all's questions as possible so that everyone can walk away feeling like they were heard and that they got to say what they wanted to say. I'm so excited that you guys are all here. I know it's a bunch of y'all from different places all over, and I'm so excited that we're doing this. So enough of me chatting. I was just really just trying to ramble on enough before we actually get started, so that I can give everybody some time to come on in and get settled. So if you guys have any questions about like event stuff, definitely shoot an email. But my assistant Shaq is also here, so she can kind of help out. But hopefully everybody got in okay. So let's just get this thing started. Hey everyone, welcome. It's Pregnancy and Cannabis Workshop time. Okay, so I'm gonna go ahead and introduce our panelists because they are amazing and super duper qualified to be chatting about this one way or another. They have either consumed cannabis during pregnancy themselves. They're professionals, they're experts. And so we're going to be talking about this for you guys today. I am going to start with Hannah, who is a doula. And I'm going to spotlight her. And I would love for you to introduce yourself and let the folks know, what it is that you do. And yeah, she's our first panelist.
Yeah, my name is, thank you. I'm so excited to be here. My name is Hannah. I live in Chicago with my partner and we have a 7-month-old, and I am a doula. I consumed cannabis when I was pregnant, and I also am a supporter of using cannabis during pregnancy for any people that I work with. And I am looking forward to questions at the end and can't wait to hear about the Kushners' video.
Thank you so much. I can't wait to get into this panel, but the video is going to be great too. Okay, so thank you so much, Hannah. So that's Hannah. We also have so many of you guys here, and I got to scroll through all the participants. We have Tunisia, who is a proud Canna mama, and she is also going to be a panelist today. She was on the Blunt Blowin Mama podcast, so you guys may have heard her there. She's a mom to 3 boys. She's proud about consuming cannabis during her pregnancies. Talks about it to anybody who will listen, which makes her highly qualified because the way she consumed cannabis during pregnancy, I didn't even know it was possible that she could consume during labor until I heard from her. And I was just like, oh, okay, that makes sense. So Tanisha, go ahead and introduce yourself. Say hey to the folks, let them know who you are.
Hey, ladies. I am Tanisha, and like Shanitria said, I am a mother of 3 boys, ages 5, 2, and 1. And I've consumed cannabis throughout all of my pregnancies. My first pregnancy, my first boy, he was born in the hospital. And my second and my third, they were at home natural water births. And like she said, I'm just very authentic, raw, honest, truthful about my truths and my journey. And I just like to share that with others to make others comfortable within their truths and their journey as well. So I'm excited to share from my perspective. And I thank you guys all for being here.
Yay! Okay, so we're going to jump into our next panelist, who is Gabby, and she is one half of Moms Who Cannabis. You want to go ahead and introduce yourself, Mama?
Hi, I'm Gabby, one half of Moms Who Cannabis, and I'm excited to share my story as well. I consumed cannabis while I was pregnant with my second child, and that's kind of around the time that me and my partner made Moms Who Cannabis. And I'm just excited to share my story and answer some questions and just speak my truth.
You're muted.
Yes, Shinichio, you're muted.
I saw a photo of Gabby pregnant, holding the joint. I was like, oh yeah, this is what we need. Like this helps to normalize it. So thank you so much, Gabby. And then we have our last panelist, and there she is. She's the other half of Moms Who Cannabis. And should I call you Nay, or do you want everyone to call you? Should I call you Nay?
Nay or Shanae. That's fine.
Okay. Okay. Welcome. Let the folks know who you are. And yeah.
I'm Shanae. I'm the other half of Moms Who Cannabis. I live in San Francisco. I'm a mom of 2. And I'm just an advocate for plant medicine. And I'm so happy that we're here today to share with you guys just our perspective, our journeys, and continue to just advocate for people who choose cannabis throughout their pregnancy and just have community with everybody. So I'm excited to be here. Thank you, Shanitria, for hosting and all of the participants today. We wouldn't be here if it wasn't for y'all.
Absolutely. Thank you guys so much for those intros. So we're going to jump into the panel. But first, I have a special video from Sandra, the Kush Nurse. She's a registered nurse. She's known online on Instagram as the Kush Nurse, which I just think is like such a clever name. I was like, are you a real nurse? Because the Kush Nurse, she's great. She couldn't be here today, but she submitted a video answering some frequently asked questions about pregnancy and cannabis. So we're going to cue that up and play that for you guys first. And then after the video, we're going to jump into the panel. And then after the panel, we have the Q&A. The video is about 25 minutes. So that will give you all some time to sit down, smoke a little weed if you want to, drink a little tea, and get some knowledge from the lovely Sandra the Kush Nurse. So we're going to cue that up for you guys right now.
Hello, everyone, and thank you so much for having me on this panel. I'm super excited to speak to all of the moms to be, or those who are kind of curious and not quite on their mom journey yet. Speaking about cannabis and pregnancy and breastfeeding is a very challenging topic because not that we don't have enough evidence or information, but we don't have any official clinical data, and that's really the hard part of saying what cannabis can and can't do. However, cannabis has been used for thousands of years. We have enough information to know that it is a pretty safe drug. It has one of the highest safety profiles of all drugs, including pharmaceutical meds. And we've never seen a death due to cannabis. So I say all that because as I start answering some of the questions that were sent over, it really kind of helps put me in a position where I can not only share with you the research that's out there, but also share with you why some of this research is flawed. So, one of the first questions is, what are the safest methods to ingest cannabis while pregnant? The pros and the cons of cannabis consumption during pregnancy. So, first of all, the method is going to depend on what it is that you are trying to resolve. So I follow quite a few practitioners and clinicians, and I really go with what is being practiced, not necessarily what's in the research, because a lot of the research studies show self reporting. And what that means is that there was a survey or something, some way that a patient was asked to self report if they use cannabis. Well, I don't know about you, but as a cannabis patient who I haven't been a cannabis patient very long, but I've been a cannabis patient long enough where it's taken me quite a few years to talk to my doctor about cannabis. At first, it was something that I did, I consumed, and I used for medical purposes without really revealing that to my provider. And as a nurse, there's many reasons because I couldn't find the evidence or the research or all of these other things. However, over time, what I found is that a lot of times we will need to rely on anecdotal data. And what anecdotal data is personal accounts or personal stories or information that we gather from patients and individuals that are willing to share their results and kind of what their progress or process has been. So with that said, Dr. Sulek, who is a wonderful cannabis doctor, I love to follow him. I also love to follow a lot of the researchers who have been out there. Melanie Dreyer is one of the longest standing cannabis researchers of our time. She's been researching cannabis for many years, and with a very good results, to the point that because she couldn't find many negative results with mothers, with children that have been exposed to cannabis in her research that she did in Jamaica, in the Jamaican study that many people have heard of. Her funding was cut because what they wanted was to find negative things to say about cannabis. And because she didn't have those negative things to say or negative impacts or effects, they felt that the government wasn't going to like these results. And she has actually spoken about this freely on many different podcasts and webinars. So it's not something that's top secret. So there's a lot of things to know about cannabis, but one of the things that's recommended the most is that in the studies, what we do know is that smoking, specifically combustion. So what that means is if you have a joint, a blunt, a bowl, or anything that you light a flame to, you are going to get carcinogens. Carcinogens are what happens when we are burning things and then we inhale them. And those things can be detrimental to our lungs and also detrimental to the children or the fetus. So those are some of the things that we do know. We do know that smoking causes these, issues. However, there's a million ways that you can consume cannabis. So there are other alternatives because we've looked at the risks and we looked at the benefits, and we see that there are women who could benefit from using cannabis during their pregnancy or during breastfeeding. And in those, in this work, what we found is that the safest, cleanest way would be to use a dry herbal vaporizer. So dry herbal vaporization is what's recommended. You can get a dry herbal vape. Basically, you crush the weed, you put it inside the vaporizer, it heats it to a certain temperature, and then you only inhaling the vapor without the carcinogen. So it's a clean way to consume cannabis. Inhalation is one of the best methods, and the reason why is because it's easy to control. You can have 1 puff, 2 puffs, and you can feel the effects almost immediately. Where with tinctures or oral methods, edibles, things like that, it does take a little bit more time. So it may take 30 minutes to an hour before you are metabolizing that and actually feeling those effects. So depending on what the condition is that you're trying to treat, that's the method that's going to be best. If you are dealing with pain, maybe it's something that you can manage by having something orally that's going to last throughout the day. But if you are experiencing stress, anxiety, or very intense pain or vomiting, then having something that you can inhale immediately and feel those results right away is definitely going to give you the best and quickest relief. And so when we look at the information that we have and looking at what the methods are, inhalation is a pretty solid method. And it also will allow you to kind of control how much you're consuming. But what we do know is that women who consume cannabis share during their during pregnancy and breastfeeding. The cons, I mean, the biggest cons is, what the method might be. So, and finding and sourcing clean cannabis. So making sure that you're getting cannabis from a good source, that, it's clean cannabis, that you can get lab reports on it, because you want to make sure you're not consuming anything that could be detrimental to your health or your baby's health. There are some reports, and I think consistently the reports are not great because they rely on self-reporting, and self-reporting is not a really good method for determining, how much cannabis somebody uses and when they use it, because people aren't really, you're listening to the words coming out of my mouth, and I'm sure wherever you are, you're probably not comfortable discussing cannabis use with your provider. So under the circumstances where these individuals were releasing that information, we don't exactly know what that environment was like, and if they were comfortable being completely honest, if they shared, everything that they're doing. There's just not enough information with that. So the cons that we have seen in the data, which again comes from self-reporting and not a very good quality of studies, shows that some infants, and this is something that's come up in pretty much all the studies, may show lower birth weight or early or preterm labor. That the baby might come early based on individuals that consume cannabis. We don't know what kind of cannabis. We don't know how long they were consuming cannabis. We don't know how much cannabis they were consuming. Many of these studies were conducted with individuals who used other drugs. So it's very confusing how they obtained this information. So I want to always preface that, because I do share a lot of studies, and I always try to give you the best, what I can glean from this based on the information that's provided, knowing that there's a lot of holes in this data, and that again, pregnant women are usually or are not, included in many of these clinical studies or trials. So, a woman wouldn't be taking cannabis under clinician's care or provider's care, and we're getting like real-time results as to how that's working, because we're not there yet. Again, safest methods we talked about. I like to always reference, again, Dr. Sulak. He has shared some information that I think is really helpful, because in some cultures, cannabis tea is something that has been used, and it actually shows a lot of results in women who consume cannabis tea for nausea, vomiting, insomnia, and for relaxation. So there are a lot of positives, honestly, with using cannabis during pregnancy, but there are also those many unknowns. Okay, most of the unknowns are because we're just not able to conduct these studies on pregnant women. So that's my disclaimer on that. Where can you find first person accounts and research on cannabis and how it supports severe morning sickness? So I have a few groups that I do recommend. One of them is Canna Mom of Color, and I can share these links here. The other is Moms Who Elevate. Both of these groups are in Facebook, and they're great resources for women who are looking to find other women who consume cannabis during their pregnancy, their results, and how they're doing now, how their kids are doing. Like, I feel like I always get really good feedback when people join these groups because you get the support and the real life women sharing their stories. There are many, many things to consider when using cannabis as medicine. And most of them are the legal repercussions or the systemic repercussions of cannabis use. So as I mentioned before, for all recommended purposes, I usually recommend inhalation. Cannabis smoke has many of the same chemicals as tobacco smoke, and exposure can lead to, developmental delays and things like that with smoke. Okay, I want to specifically say with smoking. Okay, for that reason, when the risk outweighs the benefits, we recommend inhalation via dry herbal vaporizer as the safest method. So if you smoke, does it make it the worst? No, if the risk outweighs the benefits. If you are suicidal and having that joint is going to help you, get off that ledge and come back to reality, then that risk outweighs the benefits. Okay, I mean, the benefits outweigh the risks. So I want to make sure that, I'm clear with that. Like, if the benefits outweigh the risks, then of course we want to use cannabis whenever possible to support that situation. For finding firsthand accounts, I always recommend the groups that I mentioned. Also, projectcbd.org. They have great articles and resources with supportive studies, as well as cannabisclinicians.com. They also have a lot of good resources there and articles about pregnancy, and they kind of dive a little bit into the research and the research findings. What are the effects, if any, on a baby if the mother consumes cannabis while pregnant? So research on pregnant women is very limited, and usually pregnancy would preclude women from these studies. I mean, they would not be able to be part of any of these studies. So we don't have that data or that information. All of the studies that we have mentioned, that you see in the news, all of these reports and studies are self-reports. That means that somebody completed a survey, a mom completed a survey at some point, or she was part of a screening of some point where she reported that she consumed cannabis. So in these reports and in what we've seen, the effects, if any, on the baby have been, like I mentioned before, possible preterm labor and possible low birth weight. And again, when we look at the self-reporting as a whole, it has a lot of it leaves a lot to be desired there. There's a lot of holes in the work. So, for example, in a study, I think there were like 74 women that were cannabis users. Only, I think it was like 60 of them were reported, and I'm just giving you like random numbers here, but I think it was like 60 or so tested positive for THC, but didn't report it in the screening because there was questions that asked them if they consume cannabis, if they smoke cigarettes, and some of them did not answer any of those questions but tested positive. So there's a lot of discrepancies here, and because it's self-reporting, we don't know how people feel, how these women feel about reporting their cannabis use. They may be, concerned with losing their child protective services, losing their job. Who knows? It can many, many factors. And especially when we're talking about low income families, which many of these studies are conducted on low income families who are relying on, government funding, government funds, welfare, living in government housing, which does not allow cannabis use. So there's many things that are impacted when they're asking these questions. So that is one of the reasons why we look at these studies, we take as much information as we can, and then we have to get to a point where we say, okay, we have enough evidence that suggests that it is safe and that we can support women through this because it's their choice. And so many times what we try to do is, deal with each person individually. What are the conditions? What are the symptoms? What are they experiencing? And how can we help them? And have we exhausted everything before cannabis to see if cannabis is really what could be most beneficial? And sometimes it's using cannabis in addition to other medicines or other things that give us that balance. So everybody is a whole person, a holistic being. And so we should look at each individual without judgment and with the ability to understand that this is the person's choice, this is this woman's choice, this is mother's choice. So that is where, what we try best to do in these situations. Are there any reports on behavioral development of children beyond 5 years of age whose parents consume cannabis during pregnancy? So I have looked at quite a few studies. The Melanie Dreyer study, the Jamaica study, she does go back after 5 years to look and see, the results of these children who mother had given them cannabis tea 3 times a week to help them become better citizens, more intelligent. They just felt that cannabis tea could really help with this individual's, lifelong learning and health benefits and mental wellness. So it was something that was considered like you're doing a good job for your child because you're providing them with cannabis tea. Going back and looking at the study, she saw that these children actually did very well, and they couldn't tell if the results were based on the children had cannabis tea or whether these were just moms who really took care of their kids and ensured that their kids were, kind of making the marks and living in society the right way. However, there were no developmental delays or any other issues. And anything that was seen that might have been developmentally delayed was equivalent to the general public or population, which also goes back to share a study from the farm. So the farm was a settlement, an intentional community in Tennessee, where a midwife, Ina Mae Gaskin, she's known as the authentic midwife or the midwife of authentic childbirth. And her role was to not only be a midwife, but she also trained women on this farm to be midwives, even though they weren't nurses or clinicians or anything of that nature. So they were laymen or laywomen who were taught how to deliver babies. And they looked at this study, and I'm actually going to look at my notes because I did write down the number, but I think there were 1,900 births on the farm, and the total births which were low birth weight, were less than 0.002. So what does that say? Out of all these 1,900 births from 1920 to 1994, they saw 4 births that were low birth weight. So in another survey they conducted, 71 women who gave birth on the farm to over 175 children reported that 50% smoked cannabis during labor, and most reported it as having beneficial effects. I think they had one woman whose labor stalled, and that makes complete sense because when you're using cannabis, it has that relaxing quality or those sedative properties, and it can cause muscle tone relaxation. And so it would make sense that it would put us into a relaxed state and possibly potentially not necessarily relax the uterus, but it might relax the input that we would be getting from that nerve pain that would cause us to, do the work of contracting our uterus and, helping facilitate birth. But it makes sense to me in this limited research that a place like this would have access to their own medicine. They probably grew their medicine on there. This is something that I still need to research more. But that they show that women used cannabis during pregnancy, labor, and lactation. So one of the biggest questions that we get is, how to talk about cannabis with your provider. So this is challenging, and based on the state you're in, is going to be even more challenging. So the first thing I want you to do, regardless of what state you're in, is go to normal, NORML.org, and make sure that you know what's legal in your state. If you don't have, a legal recreational, that you can just access, can you get what is your medical program where you are? Can you ensure that your condition is on that list? So every medical marijuana program in each state has qualifying conditions. And those are conditions that doctors who prescribe medical cannabis or recommend medical cannabis can recommend for. So if you have one of those qualifying conditions, then it would be beneficial to know that first, that you actually have one of these conditions on this list, and that you're able to be, to receive a recommendation for one of these conditions. So what happens is a lot of times people have conditions that are not on this list. For example, if you have lupus may not be a qualifying condition, but if you have chronic pain due to lupus, or you have anxiety or some other condition due to lupus, then you may be able to qualify under that particular condition. So if you are not in a recreational state and you have to talk to your provider and you have to get your provider to recommend, that becomes, something where you want to, again, have the qualifying conditions. If you have any supporting research that you can provide, always, if you are not able to find the research yourself, reach out to a cannabis nurse or a cannabis educator that can help guide you towards that research and that data. But this is what I recommend when people go to their doctor. One is asking your doctor, do they know about cannabis as medicine? Because many doctors do not know that. It wasn't something that was taught in medical school. It wasn't something that was taught in nursing school. So before you talk to your provider, you want to know a few things. I would definitely recommend keeping a cannabis journal beforehand, so you know exactly how many times a day you take cannabis, what you were feeling before you took it, how you were feeling afterwards, and all of the benefits that you felt by using cannabis as therapy. So before cannabis, I felt tired. I was sleeping 1 hour a night. I had trouble falling asleep. I had trouble staying asleep. I was having restless leg syndrome. I was nauseous. I was vomiting. I was stressed. I was all these things. Whatever it is, you want to have a list of those things. And then with cannabis, I'm able to help my children with homework. I'm able to cook dinner. I'm able to, do simple everyday things. I feel like I can focus. I don't have pain. I'm not vomiting. Whatever those things are, insert them there. I'm able to get 6 to 7 hours of sleep now, and I wake up feeling restful. Whatever those things are that you're experiencing, that is what the doctor needs to know. And then if you're able to, and you feel comfortable, I would definitely say how many times a day you're consuming, which is also very scary for people, because people that don't understand cannabis may think that you're just supposed to consume cannabis once a day and that's it. But sometimes if you're replacing your pharmaceuticals with cannabis, or if you have a condition that warrants it, you're going to need cannabis several times a day. You might need something to help with focus and stress during the day, and something to help you with sleep at night. And so it's not uncommon for people to use cannabis more than once a day. And so it's very important to share with your provider not only, what you're using, but how often you're using it. This is going to show that you are keeping track of what you're doing, that you're responsible, and that you brought the research with you about why it works. And also that that you're sharing this progress with them in a written format. A journal is a great way to do that. And there's plenty of cannabis journals out there, that you can use. And in addition to that, like I said, bring the research that supports why cannabis is helpful for you during pregnancy, for hyperemesis, for chronic pain, whatever it is that you're going in seeking that support for. And so, there's many ways that we can support women if we use the information we have, and kind of, instead of saying every woman should use cannabis during pregnancy for this or that, or every woman can, it's looking at you as an individual and saying, let's look at you. Let's see what's going on with you. And is cannabis the best solution for you? Because it may be, and it may not be. There may be other options for you that are beneficial as well. It's just, knowing you, what medications you need, what conditions you have, and looking at you as a whole person. And that's really, if I could ask for anything else in this world, it would be that every doctor would look at their patient, or every medical professional would look at their patient as a individual who is a whole being, and that we look at the greater good of the person there. If I look at the thousands of women that report cannabis use and their results, I feel that it is a resounding yes, that it is beneficial and that the benefits outweigh the risks. So thank you so much for having me on here today. You can find me at the Kushners pretty much everywhere. I'm happy to answer questions or send you to some resources. And thank you again. And I look forward to not only hearing more from you guys about what you want to know about cannabis and pregnancy, but also in knowing, what are the benefits you've seen with cannabis and pregnancy or cannabis and breastfeeding. What has been your story? Because the more stories we share, the more we can build this anecdotal or this story based support system that we have right now. So thank you guys and have a wonderful weekend. Enjoy the rest of the workshop.
Wow, that was amazing. So, so good. Continue, like really covered a lot of ground, and so thankful for that. Thank you to Sandra. Definitely follow her on Instagram if you want to catch up with her. She also has a podcast. I don't know why she didn't mention that, but she has a podcast as well. So definitely check that out. Follow her on Instagram. Send her DM if you ever have question. She's a great resource. She was on the if you go to portal, you can listen to those episodes in addition to the episode of the podcast that Tunisia was on as well. If you want to go a little deeper after the workshop. So let's hop into this panel because I got questions for you ladies and I want to hear your answers. It's time to talk about pregnancy and cannabis and how it's helped you. So my first question, and this is to whoever wants to start first, is what was your cannabis consumption like before pregnancy? And were there any concerns about cannabis negatively impacting your fertility or your ability to conceive?
I'll go first because mine is pretty simple, but I personally have always smoked. So I think I started smoking when I was like maybe 13. I'm 28 now. So maybe like 15 years I've been smoking. So I kind of just eased to it. And I come from a family that did it often and frequently as I was growing up. So it was kind of just like a vibe in my house. So for me, it was just very easy flowing into my pregnancy. But I never had any concerns about like infertility or like any type of harm. I never was concerned about that. My concern ever was only like social workers, because I was giving birth at a hospital. So that was my only concern I've ever had. But I was never fearful of like what could happen to my babies.
I agree as well. I grew up very in a normalized cannabis household. So I would say for me, same thing. I didn't have any worries prior to or no trouble with fertility before consuming. I would say it was always recreational beforehand. So I kind of just kept it the same. The first pregnancy, I did not happen to cannabis at all. That was 10 years ago. My girls are 10 years apart. So I wasn't educated as much as I was the second time around. And so I would definitely say that, nothing really changed, just knew a little bit more. So educating yourself is super important.
So I've always been a smoker, and my first pregnancy, I definitely was like first time mom. Oh, I can't smoke. I got to do everything like by the book. And, some of my family members or even my peers would be like, it's bad. You have to, stop smoking, stop doing everything. And so I listened. But with my second pregnancy, I felt like I was fine. I was more educated. And it actually helped me. So I was like, why not? I'm pretty sure I'm not harming my body or my baby. So, I'm fine. It's helping me eat because I wasn't eating. So I just kept doing it.
Yeah, I grew up in a very conservative house, so weed was not very accepting. And then I started seeing my partner who's a big smoker, and so he kind of had an influence on me. And so I was smoking and taking edibles before I was pregnant, and then also while I was pregnant, it really helped. Like Gabby said, eating, I could not eat. I was not sleeping very well. It helped me sleep at nighttime. I kept waking up at like 3 o'clock in the morning, wide awake, needing to eat cereal, and then couldn't go back to sleep. And I'm still breastfeeding her. She's 7 months, and I still am smoking and taking edibles as well. So it's been helpful. I didn't have any concerns about fertility either, conceiving. So.
Yeah, I would definitely say that I never even thought that weed would impact my fertility or my ability to conceive. It never even crossed my mind that of all the things in my life that I was doing, I felt like that would probably have the least impact on my fertility or my ability to conceive. I would more so look probably at my diet, like, what am I eating? Am I drinking a lot of alcohol? Like stuff like that. I feel like, or am I smoking cigarettes? Like, I think stuff like that would probably impact. Am I doing hard drugs? Am I like snorting coke every day? Like, I don't know if it's a good idea. So yeah, I think that like Sandra said, looking at everything holistically and taking everything into account when trying to conceive. But I wouldn't say that like weed ever played a factor in my ability to conceive. If anything, weed is probably the reason why I have my kids, because I got a little too faded, and 9 months later, a baby. Just one night on wedding cake or whatever strain, and then it's like, oh, here comes the baby. So I would say that. Okay, so my next question I want to ask you guys is, if you consumed cannabis while pregnant, why did you decide to do so? And what method or route of consumption did you use?
So I'll go first. I like to smoke joints. I used to love backwoods and like swishers and all that. But when I found out I was pregnant and I was going to still consume, I was like, okay, I'll just stick to joints. And that's how I consumed. I also did edibles because I love my chocolates and my tinctures. So I was just still like getting high, but also feeling good. And also just consuming not how I normally would as far as how much I would, but still just treat it like it's normal. And that's why I found that the benefits of cannabis is by even just trusting my own body and my own self with it. And I smoked the whole way through, and even breastfeeding. So the only time I had my break was in the hospital recovering. And then when I went home, I was like, all right, it's time to smoke. So just listen to your body and, keep puffing.
I'll go ahead and piggyback off of Gabby, because I'm definitely similar. So actually with my first, because with my first, I didn't really have any idea of like home births. Like I knew that what they were, but I thought that they weren't for my type, So I just thought that I had to give birth like at a hospital. So I was like, dang, like I'm gonna have to stop smoking. And honestly, like the only break I've ever had from smoking was the few months within this first pregnancy, because I was fearful of like the social worker thing. And then after a while, I got over that and I continued smoking until I gave birth. And, but I just lost my train of thought. I was going to say the type of method that I was doing was joints and stuff. Like I would stop smoking the swishers and the tobacco. But what I just learned from Sandra is like, I didn't realize that any type of, thing that you're lighting is causing carcinogens. So I was completely unaware of that. But I thought, the cleaner, the better. So I thought joints were cleaner than, like tobacco with the swishers and stuff like that. So I would smoke joints throughout my pregnancies. And especially with my first one, the first trimester, I was like, okay, I'm just going to smoke just to ease the nausea and all that stuff, because I wasn't eating and it was helping me eat and just like helping me get by. And then the second trimester, that's when I took that break, because I was like, I can't smoke because I'm going to give birth at the hospital. And after a while, like that lasted like 3 months. And then my last trimester, I started smoking again. And yeah, and that was that. And I would go back to smoking blunts and stuff afterwards, which like I didn't really like. During my pregnancies, I would be like, ew, those stink, they're so gross. But then I would always revert back to them. And that happened the first 2 pregnancies. And finally, after my second one, I just was like, no. So I only smoke joints now because I feel like that's cleaner. But now I have to reconsider that because I did not know that they create carcinogens.
I took mostly edibles when I was pregnant because I had learned about the carcinogens when you smoke things. And my midwife that I was seeing, I had a home birth. I had a midwife who is like not technically legal to practice in my state. She was very open about consuming cannabis and was like, as I was complaining about anxiety, I couldn't eat, nausea, couldn't sleep. She recommended it. And I was already kind of using it. And so that was kind of just nice to hear from a medical provider that like, hey, this might help you. Kind of like we looked one-on-one personally. And she recommended edibles. And so I kind of just went that route and have been continuing to take edibles even while breastfeeding.
During my second pregnancy, I did develop hypotension, which is the lowering of the blood pressure. So I was constantly dizzy, constantly like fatigued, and had just a lot going on with the body itself. Normally that lasts only the first trimester, but for me, it lasts the entire pregnancy, even after I gave birth. I did have a hospital birth. And my provider was not understanding of the cannabis use. I did have to meet with a woman, and they basically were trying to like help me wean off of weed, but I didn't need that. But with certain providers, they will like require you to have, this type of, method to go to. So at first, when I was consuming in the beginning of my pregnancy, I was smoking. I would have my partner like hotbox me, like blow it in my face, because it honestly helps so much. And then once I started to go through with these meetings with this woman, when I visit my OBGYN, those only lasted a few months until they got my blood work back that I was no longer consuming. But I definitely switched my method to CBD. I had a CBD vape pen, and I would just do like CBD edibles for the remainder of my pregnancy. So, it did switch up for me. I did prefer the THC because it took the edge off and it helped me get rest. It helped me feel a lot better and like get my equilibrium to like be steady. That was my way.
I love how all of you guys had different experiences, but it's still kind of the same, like we were all mindful of ourselves and thinking about like, hey, I'm going to mindfully switch my consumption method because of this. Hannah, that's amazing that your midwife was so supportive in that way, because that is rare.
Yes. Yeah. She referenced the Jamaican study a lot. And so that's kind of where she got all of her information from, and followed what that woman was saying too, when she came out about what was happening with funding and things like that.
Yeah, that's really like a major key because I feel like that's the purpose of medical professionals, right? Is to kind of come in and provide solutions, and not just be like a pill, but think about everything in the ways that are most helpful. And edibles are like great, great, great. When I was pregnant, my first child, I did not consume and I was miserable. And after I had her, I said, never again. If I get pregnant again, I'm going to keep finding a way. I'm going to find a way to keep consuming cannabis. I started Blunt Blowin Mama and I talked to so many different women and I was like, they're all doing it. Maybe that's why people like pregnancy, like, because it can't be this miserable experience if people keep having kids. Like there's a cheat code in here somewhere. And so I had like really bad pregnancy depression with my son, and it was just so bad. One weekend I didn't get out of bed. I started having suicidal thoughts, and I thought to myself, this can't be good. Like if you're doing this is like the worst thing you can do while pregnant with a child. Like that energy that you're passing on, like, and you have another kid, like my oldest, who's walking around and you're just a zombie. So I decided to smoke a joint because again, I was thinking, this has got to be the cleanest way and the quickest way to get what I desired, which was feeling like myself again and not being depressed. And that helped me so much. And I never looked back after that. I was like, oh my gosh, I took like 1, 2, 3 pulls and that's all it took. And I was myself again. So yeah. And then for the rest of my pregnancy, I took tinctures, I had edibles, topicals rubbed all over my body. I was huge with both of my kids, and with my son, he was no exception. He was 9 pounds, 1 ounce. My back was killing me for that last month of pregnancy. Can you imagine a month of carrying around this giant child? So topicals helped me tremendously. And I always recommend to women, like sometimes it's not even ingesting cannabis. It's just rubbing your body, that inflammation. Your body is swollen. It is hurting. Even a CBD bath bomb could probably do wonders for just your physical state and how you feel. And if your body feels good, you're going to feel good, So thinking of different ways to ingest and to incorporate it into your life is really important. There are, options like gummies. There's Sandra mentioned vaping, and I didn't even think of like get a dry herb vape, right? So many different types on the market. And that is such a clean way. I actually prefer my dry herb vape when I'm traveling because I can still smoke my flower without there being a smell in my Airbnb or hotel, whatever. And it's cleaner because you're inhaling those vapors instead of the combustion that happens when you're lighting up. And the carcinogens, like, I didn't even know that part either. So definitely think about your methods. You do have options. So my next question I want to ask you guys is, how long did you consume cannabis during pregnancy? Was it the entire 9 months? Was it only the first trimester, the first and the second trimester? Did you make a decision in your head that, okay, I'm going to stop at this point? Or did you say like, I know, Gabby, you said you smoked the whole way. So how did you guys come to that decision of how long you were going to consume while pregnant?
Well, I did smoke my whole pregnancy, but like towards like the end and my third trimester, I was like, okay, I think I'm going to slow down. I think I'm going to stop. And then I wouldn't because it was just natural to me to just smoke. So I was like, just kept it going. And I felt like, okay, I already did it for this long. Why am I going to stop now? If there would be something wrong, it would already have been taking place. So I just said, you know what, I'm fine. And you just got to like trust your intuition and trust your body on things sometimes and just know that, you're okay. You're okay with it and you are helping yourself still. So I would just say go off of how you feel to kind of make that decision.
I agree. Definitely listening to your body and your intuition. I didn't really have an idea of how long I was in a cannabis during pregnancy. I just knew that it was helping. So As soon as I knew that I couldn't smoke weed anymore and like have THC be in my blood system, I knew that I would still consume with CBD because of the benefits. And like you said, it's not just, what we're ingesting, it's what we're applying topically that felt good. That's still cannabis. So it for me was the entire pregnancy, whether it was, me smoking, eating a gummy. I'm a big fan of tinctures and of course the body creams, bath bombs, you name it, I did it. So
I definitely consumed the entire time. I took it more as needed. And I did it because I would prefer it over taking like an ibuprofen or a Tylenol because it's a medicine or a plant. So that sounds better to me than Tylenol or ibuprofen. And so I used it the whole time I was pregnant.
Yeah, so I already said, kind of what I did. Like my first pregnancy, I did think that I had to stop for a little bit, which I stopped for my second trimester. But after I was like, you know what, like there's really no harm. I got over the fear of like the social workers, being involved because I'm like, if they were to be involved and come to my house, like they would see that, he's well taken care of, like whatever, I'm not a bad mom. So I got over that fear. And that's when I just decided to, that's just what I'm going to do. I'm going to smoke during my pregnancy. So my second and third, I smoked all the way through those ones. I just became more intentional about like how often I was doing it. Like, outside of pregnancies, I could smoke and smoke and smoke. Like, y'all want to smoke all day? Let's smoke all day. We have company over, like, let's smoke, smoke, smoke. But I obviously wasn't obsessive like that during my pregnancy. So I would kind of only smoke as needed, maybe like 1 to 2 times a day, during the day to just kind of like woo-saw me and at night to chill out. So that was how I did it.
I love hearing that. Everybody had different ways, but everybody said that like you listen to your body. I think that's the most important part. Okay. So my next question that I have for you guys is how did you talk to your family, your partner, and friends about your decision to consume cannabis during pregnancy, or did you keep it to yourselves?
I feel like for me, there wasn't really any conversation because, like I said, I come from a family that utilized it. Like my mom utilized it when she was pregnant with me. So I feel like there was really no like conversation to be had. It was just kind of like thing. And I never had any problems with anybody like question me about it or anything as well. So that was my experience.
My experience was pretty much the same. I mean, I have cannabis normalized in my family. If anybody raised concern around it, it's probably my mom. She's pretty straight edge. She doesn't drink, she doesn't smoke, she doesn't do any of that. So she might have, said her piece a few times about it. My partner was super supportive. He was the one who was dealing with me day in and day out when my, low blood pressure would hit. And I would seriously be like, stop, like the world stopped because I was like, I got to go to sleep. Like I'm down. So he was somebody who, I really appreciate who was understanding. And I think that's important if your partner is supportive of that. And same thing, he knows that we're more holistic when it comes to medicating. So he didn't want me to be taking prescription medication. So he knew that cannabis was safe. And luckily for me, he's someone who did try to help us like learn more and educate ourselves while we were pregnant with our second baby. So I'm super grateful. And I hope everyone has that level of support because it really does make a difference if your partner is, in support of that. It's definitely necessary.
I agree with Shanae on your partner being supportive because I feel like at first, like my mom, she was just kind of, are you sure you should be doing that and just be careful? And it was always like, oh, you're still smoking. Oh, and it would just be kind of more like annoying. Like, yes, I'm still smoking and I'm not going to stop and I'm fine and my baby's fine. So just having my partner, he's a smoker. He blows it down. So just having my partner already being a cannabis consumer, he also was like, oh yeah, weed doesn't harm the baby. And when he said that, I was like, this was his first kid. So I'm like, well, how would you know, And I never really got his intake on that part of cannabis with it. So it was good to just know his point of view on it and him knowing like babies are fine. Study shows, that some babies with cannabis, born with cannabis, they're a lot more like faster sometimes when they're like with their milestones and things like that. So it was just good to know that somebody's got your back on this, because it's taboo for you to smoke and consume during pregnancy, because like I said, that was like my number one was joints during pregnancy. So for people to see you with the joint and a bump at the same time is like, what the hell is she doing? So it's just good to have somebody in your corner, and it makes it easier for when you do come to those conversations where somebody is questioning what you're doing, and your partner's there to just back it up.
I was pregnant during, the pandemic is still happening, but I was pregnant during it. And so we didn't really see very many friends or family. So it didn't really come up. The friends that I were close with knew while it was happening. And because I posted that I was going to be on this panel, all of my friends probably know now that I used cannabis while I was pregnant. So it's people are pretty cool when they hear about it. There's not too many people who are like, oh my gosh, aren't you worried? Also because it's, I think, becoming more normalized and not as taboo. So that's definitely a bonus that's happening. But yeah, we didn't really talk about it with anybody because we didn't see anybody. And my partner uses cannabis, so he was very fine with what was happening.
It is really helpful when your partner is supportive. And I just am so thankful that mine, not only is he supportive, but he also can smoke circles around me, and people see me and they're like, oh, you smoke so much weed. I'm like, wait until you meet my man. It makes me look like, I don't know, it's crazy. So when I asked him, because I asked him before I took that first smoke, because I was like, yeah, it's your baby too, I guess. So do you care? Does it matter? And he was like, yeah, it's fine. He's like, I think, wouldn't it be healthier to take that than to do something else? To take a pill or something? And I was just like, yeah. He was like, I mean, I don't know. I haven't done any research, but I just think, and I'm just like, you're right, dude. You're onto something. And so I think when you have somebody who's gonna, like Gabby said, back you up and to be there to have your back, if somebody does try to question you, just makes you feel comfortable. Because at the end of the day, the only person's opinion that really matters is your partner, the person that you're making this baby with, because that baby is half of their genetic material as well. And so their input matters the most. Everyone else, who cares? Go kick rocks. That's how I feel. But it is, important to talk to them. If you feel comfortable talking to them about it, maybe it's after the fact, because you do want to stay in a zen and stress-free state when you're pregnant. But I would definitely say your spouses or your partner, or, that they're the most important, having their support and being able to talk to them about it. My next question for you guys is, what were the effects, if any, on baby from your consumption of cannabis while pregnant? I mean, did you feel like anything was different? I personally did not. If anything, I would say that my son beat me up third trimester and he was kicking me. I think he was trying to find a way out. And that's the only thing. I never slept that night. And my only regret is that I didn't discover CBN until after I had my child, because if I knew about CBN, I would have been having a gummy every night and I would have slept so well. So, something to keep in mind for my possible third pregnancy in the future. But if you know better, you definitely do better. But were you guys concerned at all? I was not.
I didn't have, like I said earlier, I didn't have any negative concerns. But after the fact, more so positive effects. They say that they And I don't know, like, I don't know if it's this or that or like what actually contributes to it. But like my first son, he was crazy or still is. Like he's crazy, extremely advanced, smart. Like he's only 5 years old and he's like out of the world smart. Since he was like 6 months old, he would be like turning the pages of books and like just like doing all this crazy stuff. But then he's also a Gemini. I'm like, I don't know. Like, is it the Geminis? Because like, I don't know what it is. But all my babies are pretty smart, I would say. I don't know what's considered like low birth weight. But you know, they've all been 6 to 7 pounds, which I feel like for me and my body stature is pretty normal. So I wouldn't say that they had low birth weight. But yeah, for me, it's just been nothing but positive effects.
I did happen to have my baby 6 weeks early. But the one thing that did really like kind of surprise even like our NICU staff and everything was how alert she was and how much she was being like progressing every day. They were like, wow, like we would expect her since she's 6 weeks early, only 4 pounds, 5 ounces to like be here maybe close to, 30 to 60 days. And we came home in 12 days. With the breastfeeding, I was cannabising. So, I don't know. We have cannabinoids for a reason. So I don't know what it was that was like being pumped into her, but she was like such a little warrior baby. And we are just like, we would just tease all the time, like it was the cannabis because she just, was a superstar, NICU baby. And I'm pretty happy. Like so many people have that idea of like, what if? But when you actually see it for yourself, how healthy your child is, whether they're born early or not, it kind of makes you feel good that maybe you were doing something right. So lean on that intuition.
Definitely healthy is a side effect, I feel. And like Shanae said, we have cannabinoids for a reason in our bodies. So I just feel like you enhance those and it goes onto your baby. I breastfed and consumed, but I felt like it helped with my milk production as well because instead of me not breastfeeding and like worried about my weight and like, oh, I need to be on a diet, I'm eating, but I was eating like a lot of fruits and veggies. So I felt like that kind of helped my production and that just all goes to my baby. And I feel like he's definitely a good eater and he loves everything, fruits, veggies, plants, everything. He is a good eater. So I feel like it's good for like if you do have premature babies because they need to get that weight up and, it just helps them to eat and very healthy and alert. So why not? I feel like that all our babies need it.
Yeah, my baby was 9 pounds when she was born. So she was healthy. That was fine and normal. And she's been like Gabby said, she's a good eater. We just started eating solid foods. Like she's doing all of the marks, meeting all the marks. So I think it's helping. I didn't even think about it positively impacting my milk, but now I'm like, that might have something to do with it. So that's exciting to think about.
It does impact. Like, I talked about this on the podcast and I've made posts about it on Blunt Blowin Mama's page. But my first child, I breastfed her for 15 months. I did not consume cannabis at all. My second child, I breastfed for 25 months. I consumed cannabis all 24 months of that. Only the first month I didn't. I don't know why, but again, hindsight is 2020. And I know there's no way I would have breastfed a baby for past 2 years of age if it was not for cannabis. It helped with so many things. And I know that it's because it helped me with my stress levels and just getting out of my head about things, releasing anxiety. I'm absolutely certain that helped me to let down more, produce more milk, and it made me mindful of my diet. I became more mindful of what I'm eating. When you smoke weed, I feel like you can enjoy your meal more. You eat more, you eat better, and all of that impacts you, which goes to baby. And it's just like, it's mind blowing because it all works together, but it starts with mom, right? So you guys y'all are killing it. My babies were both 9 pounds, 1 ounce. And my daughter, I did not consume cannabis, and my son, I did. They both turned out the same, well, in that respect. But my son is acing all his milestones. He's a genius. And you guys are not the first moms I've spoken to who basically said that their kids are brilliant, and it's kind of creepy how smart they are. Because I think Canna babies are, if they're not geniuses, they're strong. They're warrior kids. They're really intuitive. They're really just in touch with themselves in ways that I think can only help them. And I think it's that endocannabinoid system. They're firing on all cylinders. And it's beautiful to watch as they grow and develop. So just watch your kids, just keep an eye on them, and you'll see like, like, why are you doing that? How are you? My son is a great eater as well. My daughter, a picky eater. Is it because I smoked weed while I was pregnant with my son? I don't know. But he eats everything as well. So I love that. Okay, so I want to ask you.
Also wanted to add real quick, just like on the effects of cannabis, like even after pregnancy, after breastfeeding, this is like kind of a big piece of my story nowadays. I think update since talking to you, because last time I talked to you, I was pregnant with my third son, but he ended up experiencing a brain injury after he was born, which like is obviously completely unrelated to like me smoking cannabis or anything. He was healthy and then experienced a brain injury. So now he has like developmental delays from that aspect, and cerebral palsy and all of that stuff. So I actually still use like CBD and THC with him as well to help relax him and his muscles and all of that stuff. So yeah, I just think it's interesting that it goes even outside of just the pregnancy, the birth, the breastfeeding. Like we could still continue to utilize this with our children because, it's safe from what from what mothers tell. And that's upon the small research that there is, like, that's all we really have is like our stories and what, other mothers share with each other. So I just wanted to add that in.
Yeah. You know what, you guys? I didn't even put this question here, but I kind of want to slide it in because I feel like it's a good segue from what Tunisia said. But I wanted to ask you guys, have you given your kids CBD? Do they know what CBD is? Because I will say that with my son, I discovered that if I gave him a drop of CBD on his gums while he was teething, that it helped so much. The crying, done. It's like it soothed him or something. And he was so relaxed. And CBD obviously has no psychoactive effects. You cannot get high from it. So I'm thinking it was probably inflammation of the gums, right? And the CBD helped to soothe and calm that down. And my daughter, when she turned 4, I started giving her CBD gummies daily, like a half of a gummy, because I felt like, I think a lot of the acting out and a lot of the tantrums come from her endocannabinoid system being out of whack. And it's anxiety. It might be like a little bit of like, whatever things that kids can't verbally express. So I started like finding ways to give them CBD daily or maybe like 3 times a week sometimes, just to kind of balance them out if they're getting a little funky. And I'm just like, this is not you. You're not yourself. Like, let me think about when's the last time you had CBD. But I wanted to ask you guys, have you ever tried that with your kids? Have you noticed a difference? I know with teething, it's so great. CBD tinctures are like a drop on, like just a drop. And I did give my son CBN after he turned 1 month, and I gave him like a drop of a tincture and warm milk at night, and he would sleep like an angel. And he's still to this day, I don't give him CBN anymore. He's an excellent sleeper. He sleeps through the night. He's been sleeping through the night since 12 months old, and he's 2 now, and he's perfect. And my daughter didn't start sleeping through the night until she turned 3, which is around the time we started giving her CBD. Coincidence? I don't know. But they're both amazing. But I want to ask you guys, like, what are your thoughts on that? Or have you tried it? Have you seen any effects?
One of my favorite remedies that I love to share with like moms who have teething babies is CBD and clove oil. So if you mix like the CBD with a little bit of clove oil and put it on their gums, it is like saving grace. And I definitely shared that with like Gabby for her son, like do a little bit of clove oil, do a little bit of CBD, and it really helps to soothe the baby's gums. So I definitely am somebody who uses cannabis even with my children. I'm just going to say.
Yeah, just to add, so like I started doing it. Well, one time accidentally. One time we had made some food with some butter that we had that was infused, and we forgot that we infused it. And the next day we gave my son leftovers of the rice, and it was funny. He was definitely like high, but he was just like, his eyes were like just lazy, and he slept and it was over with. But I intentionally started using it with my third son because of his cerebral palsy and his muscles and joints and all of that. But my older boys would like literally like anytime I pull it out, they beg for it because I let them taste it one time. And they just start like begging for it every time I pulled it out. So I definitely do notice that it helps like relax them. But I think it speaks more to like knowing that like they actually want it because of like how it makes them feel. Cause I don't even like, tell them like, come on, like, let's do this. Like they'll see it and they're like, can I have some too? So it must make them feel some type of way and feel good. And I don't do it with them all the time, but yeah.
Well, I definitely did Shanae's remedy and it worked wonders. Before with the without the clove oil, I was just giving him CBD. I'd kind of put a little bit on his pacifier and give it to him because he started teething way earlier than my daughter did. And I'm all for it. Why not? My daughter drinks tea with me and she had a sip of my tea before and I dropped tinctures like crazy in there. So, I mean, like, I think it's harmless, really. And if it helps us, it definitely helps the babies.
I haven't used any with my baby yet, but the teething remedy, I'm excited to use that. And I'm also thinking CBD baths probably are a good idea too. Just if they're uncomfortable, sick, I probably will just put, a couple drops in the bathtub and take a bath with her.
I was going to add that my kids love to drink tea. And so I usually always have CBD honey in my house. And so I will put instead of a regular honey, I'll do a spoonful of CBD honey and put that in. And it's still honey, but it just has CBD. So finding ways to kind of put it in their drinks that they like or topicals, really. My daughter will ask for CBD if like she fell down and or hit her knee on the edge of a table or something. And she'll be like, can I have CBD? Because they just know that helps with that pain. Like they don't know how, they don't know why. They just know when I put CBD on an owie, it doesn't hurt as much anymore. And they love CBD bath bombs, but they're expensive. So they don't get that too often. I don't even get it that often. So I don't get it. But they'll be like, can we get a CBD bath bomb? I'm just like, are you doing CBD good? Like, have you been making up your bed and cleaning your room? No, then get on it and we can get a CBD bath. So it becomes like a treat kind of thing for them. And I love kind of just incorporating it into their life in those little small ways. And I try to let them know like what I'm doing so that they're aware of what's happening and in a kind of like a consensual way to let them know like, hey, this honey or this honey, do you want this? And if it tastes good to them, they'll want it again. If it feels good, they'll want it again. If not, I'm not going to force it on them. But so far, my kids are super receptive to CBD. They love it. And I love it too. I just say, make sure you know who is growing it and where it's coming from. Check the test results and everything for that. Make sure it's a reputable brand. Make sure it's a brand that aligns with your values and everything. If it's good enough for you to consume, it's good enough for your kid. You just need to obviously adjust the dose. So like I said, even with CBD, the dose that I take is not the dose I give my kids. It's totally different because they're smaller. But that's up for you to decide at the end of the day. So my next question for you guys is, how did you discuss cannabis with your midwife or OBGYN? And how did you avoid being tested positive for THC or mitigate that risk of child protective services?
I mentioned that before, that when I was in the beginning of my first trimester, I started testing positive. And so my provider definitely was like, we cannot have that. I don't know if anyone else has ever experienced this, but I did have Kaiser insurance. I did have, a hospital birth. So I think it varies by, situation. But one thing I just did mention to her about my cannabis use, I was like, look, like I'll stop. I'm going to switch to CBD, but like pregnancy is not a one size fits all. So if cannabis seems to be what's working for me and, maybe different from your other patients, it's something to consider. I still spoke my piece about it, but I was like, let me just comply, because me being a Black mother, I will be honest, I did feel a stigma, and I didn't want that to be something that carried into social work or with CPS. So I made the decision to still consume cannabis. I just switched up my method up until I gave birth. And then as soon as I, had my daughter, I started consuming THC again.
As a doula, I have definitely heard horror stories. I've never personally had clients that I've worked with experience anybody in the hospital calling Child Protective Services because they tested positive for THC. But I had to have a procedure done, so I had to go see hospital midwives, and they asked me about if I was using CBD oil or cannabis at all. And I asked, and I was using it. I asked, I said, what if I say yes? And then she said, basically, I have to open up a case with you with Child Protective Services, and they're just going to follow up. And I was like, okay, then I don't consume, because I did not want to have anything opened up that's terrifying to hear as a pregnant person giving birth. And like in a few weeks, a few months, it's threatening that is not fun. And so I just lied to the hospital midwife, and nobody ever opened anything up. But I would, if you were to disclose that to your provider, I would ask, like, what happens if I say yes? What happens if I say no? And then whatever they tell you, ask them to put it in your chart, what they told you. So if something does happen where there is a case opened up against you or something like that, you can have that documented, that this was a discussion that was had. They told you this, and hopefully they write the right thing down of what they said. So that's something that could be helpful if you're talking about it with your provider.
Well, I definitely told my provider no from the jump, and I just denied it because I was like, if I do come up positive, then they'll say something, right? So I was like, I'm going to just kind of take that little gamble and go from there. But surprisingly, they didn't. And so I was like, if they're not going to say nothing, I'm not going to say nothing. So I just kept my pregnancy going. And even after, I was a little nervous about the California screening that they do on the babies here. And, they take their blood, and I was like, well, what if my baby comes out positive in his system? What are they going to do? So I was a little nervous, but I was like, again, I'll go from there. And I know my consumption wasn't high, so I didn't think it was going to be an issue. So I kind of just took a little risk, but definitely I feel like, of course, you should just say you don't consume, because it still is obviously something that is not okay in other people's eyes. So just kind of keep it. What goes on in your house, just keep it in your house.
I have a little thing that I like to tell moms, and it's don't ask, don't tell. And if you do ask, I still don't have to tell you. But like, if it's good enough for the military for them to be like, don't ask, don't tell, then don't ask, don't tell when it comes to my life as well. And I do love what happens in my house stays in my house. And if I'm coming to these checkups and everything is turning up okay and I'm okay, I just don't feel a reason that you should ever tell your doctor unless you're concerned about something, unless something's wrong health-wise with you or baby, and you want to be able to look at everything. But otherwise, don't ask, don't tell, because it's really none of their business. If you're taking your prenatals and you're still doing okay, your baby's checking out okay, what more could they add to that? That, what value can they add to your situation by them knowing? Okay, you guys, we are wrapping up on these questions. My last question for you guys is just,
I just wanted to add a little piece, more so in the second question that you had asked, but just for the sake of it, I never intended on telling my doctor, wasn't going to tell my doctor. I just feel like that trusted relationship isn't there in the first place. Like, it's like, what are you really going to do with that information? Like, I never felt safe with that. When I had my midwife, I didn't tell her at first, but she kind of started like hinting around things, and she would mention it herself, or she would walk in and she would be like, "Oh, it smells good in here," or like, "Oh, my brother does this, that," or whatever. So one day I asked her, like, how does she recommend CBD for her patients? And she was like, "Yeah, I have this in my bag," and da 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 da. So that kind of opened it up for me to like let her know, like, okay, well, I'm sure you've noticed, but that's how we get down in my house. So that was there. But more so, I wanted to touch on that second question, which is like how to lower the risk of child services involvement. And like, obviously, I don't know like the logistic answer, right? But just from my personal experience, I think it's really about like creating what you desire for yourself, like creating your own reality, right? So I feel like most of the time, if you're wanting to smoke while pregnant, you're more so on that like, like maybe holistic side, or, you believe in like the natural way of things, right? And if it's like the fear of social workers, it's like, okay, well, how can I get what I desire without the social workers? And that would be exploring your options, like, okay, maybe a birth center or a home birth. Like, okay, well, I have this fear in my mind of natural birth and like what that looks like. Okay, well, start watching birth videos of those type of births and see what that looks like, and get more comfortable with that and educate yourself around that. Okay, well, I can't afford a midwife or whatever. Explore your options. Like, this is all my personal experience. Like, I had to explore my options, and I ended up finding a midwife that allowed me to make payments up until the baby was 2 years old. And I'm like what? Like, everything's possible. So I just feel like if that's what you desire, if you desire a pregnancy where you could just be stress-free, not have to worry about child services, not have to worry about what are they doing with this P test that I'm doing? Like, I know they say they're testing my protein, but like, what are they really doing? Like not have to worry about all that outside noise, like create that reality for yourself, because it's totally possible. So.
Thank you for saying that.
Touch on that, because I agree. Like, if I would have known that I would have had this fear of being tested, because I didn't mention it to my provider. This was something that they brought to my attention. Like, hey, we did this blood work, and this is a positive that's showing up for you. And if I would have known that I would have had that, because I didn't really think that, like Gabby said, I was consuming so much that it was going to be like readable in my system. I just didn't think like that. And so I love that you mentioned that about exploring your options and creating that reality. So if I choose to have a third child, I'm definitely going to, choose a better path that aligns with my values and something that I want for myself and for my baby. So thank you. I just liked what you said.
Yeah, and it's possible. I love like about Tanisha's story is that like you said that like I didn't think Black women gave birth at home. I didn't think that it's affordable. Like, can I even afford that? It's possible. If that's something you really desire, it will align. Like it will come to fruition if you're into your life. Like just like you manifest anything else, like you can definitely manifest the type of birth and delivery experience and care experience during pregnancy that you desire. It's your body, it's your life. Like you can make it your reality. It can be real. It can be anything you want it to be. And so we just have to take power of that. Like take ownership of your birthing experience. Okay, now I want to ask you guys about utilizing cannabis during labor and postpartum. If any of you guys utilized it during labor or postpartum, how did it help you? What ways did you use it?
I did not use it in labor. Everything kind of happened really fast for me. And before I could even think about it, she was basically born. So I didn't have a chance to use it during labor. But if I was working with somebody that was going to the hospital, I might suggest maybe before you leave, either pack edibles or something you could just take and not have to smoke. Or if you're at like home, obviously you're in the comfort of your own home or like a birth center too. If you're going to the hospital or the birth center, like, can you bring something with you? Can you, have just smoke a little bit before you leave? And then, yes. And then postpartum, I've been taking edibles. So that's been how I've used it.
I did. Oh, okay.
I just was going to agree with her that I didn't use it during labor because everything happened so fast. So for me, when my labor started, it was at 3 a.m, but like that day prior, I was just in so much pain that I just wanted to like sleep, rest. I wanted to just walk, that I didn't even find the time to smoke or to even grab anything. I don't even think I had anything else available but like a joint. So I just didn't have the time. And then I went into labor. So that's when I had my little break. But then right after, I smoked and I was a little nervous too because of breastfeeding and nursing my baby. But I did it afterwards. And then I kind of did like a pump and dump method for a little bit because I was like, oh, maybe I'll just dump it. And then I kind of was just like, okay, never mind. I was like, that's fine. So it was just a little breaks that I had just being, this is my first time doing, consuming post baby. And I kind of wish that I had it during labor, like she said, oils, creams, or something that I could like kind of make it incognito because I had bad back pain during labor. So I feel like if I had some CBD like oil or something, and they can't tell what it is, and I don't even think if they happen to rub my back and get on their hands, they wouldn't be able to tell really if they didn't have no pain. But I just think that next time I'm definitely going to have me a little bottle or something there.
I agree. We all seem like we had our babies fast. So we really didn't have like the time. Like I was rushing in the hospital because she came early as well. So it's not anything that I feel like I was really thinking about when I had the baby, but definitely postpartum. My first baby that I had, I was 18 years old. That was 12 years ago now. And I definitely was hit with postpartum depression. So I was, offered prescription medications, which I did try for a little over a month, but happened to put me more into like a downward spiral. Like I felt like a zombie, very numb. And I feel like that was affecting the relationship that I had with my daughter. So one day it's just like the cannabis plant speaks and it literally told me like, smoke me. And I did. And my life changed. I was sleeping better. I got into routine. I was exercising. So definitely when I had my second daughter, it was like a no-brainer during postpartum. I was going to cannabis.
Yeah. So both of my labors, I feel like I never really was like tapped into the early labor part, but by the time active labor came, like my babies came within like 3 hours, and it was in the middle of the night as well. But I do remember with I forget whether it was the second or third one, but trying to like smoke closer towards like transition, and my body just wasn't really like feeling that because there's like too much going on, like too much other stuff to focus. So I do think that if one was to like utilize cannabis during labor, it would be better if it was like early labor, you know, because there's not that much going on. Like, well, there is a lot going on in your body, but I'm just saying, as far as like what you have to like focus on. So, but after birth, I definitely used cannabis like almost immediately after on the second and third home birth. With like nausea and like the uterus contracting back down those, next few days to a week or whatever. But like having the nausea and throwing up like almost not immediately after birth, but shortly like after delivering the placenta, I always would throw up. So I would definitely either like smoke or hit a pin or whatever. And then, like I said, with like uterus contractions, it always helped for me to like smoke a joint while that was happening. And that's basically how I would use it. Obviously, like breastfeeding and into postpartum, definitely like to get throughout my days. Even now, like I'm a year and a half postpartum now, but I also have like grief and trauma and a sense of loss because of like what happened with my third son. So it seems like this postpartum period is like extremely exaggerated, right? Like expanded out. But even now, I feel like it's literally kind of what I need as soon as I wake up to kind of like get my mind right and move forward with my day. If not, I'll just like be in a slump until I'm able to take care of myself so I can take care of my kids.
Yeah, I love that all of you guys realized very early on, I'm going to need some cannabis after I have this baby. And that it's been helpful during the postpartum period because it definitely helped me. And I was definitely part of the camp of like, I think I'm going to have to start waking and baking more after I have like waking up at night and like in the middle of the night many times to nurse your baby and then still having to wake up because your oldest has to go to school in the morning. And that's like next level things that like you just can't even begin to fathom, like how I'm able to keep going. Like, how am I not passed out sleep for like 12 hours somewhere? Like, I don't know, but I became more intentional with my consumption postpartum because I realized like, if I medicate this way, and this way, I'm going to be able to do everything I need to do as a mom and as a professional and as a partner. If I wake and bake, I'm going to be able to make breakfast on the weekends and do all the things I need to do. And if I make sure that I have an indica or CBN at night, I'm going to get a good night's sleep and I'm not going to wake up in the middle of the night because of anxiety or whatever it may be. I'm thinking about, did I send that email? No, like I'm getting my Z's and I wake up in the morning and I feel refreshed and ready for my day. And then I do my wake and bake and boom. So it's like having that routine of being able to set up things that fit into your life. And at postpartum, I think the hardest part is just being able to fit cannabis into your schedule because you do have this baby that literally wants you to do everything for them and needs you to do everything for them. So you may not even consume as much as you like to, but that's when edibles and tinctures definitely become your best friend. If you're having a cup of tea every morning, just drop some tincture in there, have a gummy at night, different ways to kind of remind yourself, just like you remind yourself to take your birth control, remind yourself to take your gummy at night and have your tincture in the morning. Set alarms. Your wellness matters and is that important. So, okay, you guys, that was all the questions from our panel. Thank you so much for answering everything. Now we're going to hop into our Q&A. So some of you guys submitted some questions in advance using the Google form. And we're going to answer some of them. There are a lot of questions, but we're ready for it. So My first question is okay. She says, I'm currently pregnant and suffering from HG, which is hyperemesis, like the extreme morning sickness. I also had to go off my anxiety meds to take Zofran. My anxiety is worse, and Zofran allows me to not vomit, but my nausea is still hard to handle. Taking THC via edibles is the only thing that allows me to function. I currently take a candy with 2.5 milligrams THC 2 times a day. I would like to increase this to 5 milligrams 2 times a day, but I worry about taking that much. Even though this dosage helps tremendously, how do I know what is too much THC? How can I judge risk versus benefit? Okay.
So,
yeah, I'll go.
I just kind of learned about that with my son, obviously, because like he's so little and I can't just like, give him just anything, right? But what I've learned from that is like you basically like nobody overdoses off of THC. Like that just doesn't happen, right? So you start small and you build up until you notice that you're getting a little bit too much of whatever effect. So like for me, if it's my little baby, if I notice that his eyes are like red or like if he starts like laughing and stuff, like, okay, that's a little bit too much. I need to bring the dosage back down. So you kind of just start small and build up until you notice effects that you don't want to see. And once you notice those, you just take it right back down to the smaller dose. And that should be good.
I would agree with Tanisha and just say that it's definitely kind of like a trial and error. You definitely have to just keep dosing up until you see, okay, this works for me, until maybe you had a little more than you might have wanted and know, okay, I need to cut that down. So I think with edibles, it's definitely, you can kind of tell more because it's more of a body high rather than like if you're smoking or doing tinctures. Well, tinctures, you still kind of get that body high, but with smoking, I feel like you can get more of the highness quickly. So even with that, I would just say half a joint or just, smoke throughout the day if you're going to do that consumption just to see like how far it takes you. So just with anything, trial and error, but also listening and trusting your body.
I agree. That's the most important part is listening to your body. If your body is telling you, and you're starting low, 2.5 milligrams is a really very small dosage. I feel like it's a perfect microdose that we say starting out as. So you're starting low, just go slow from there, build it up. Next time, maybe try 3.5. Or if you want to go to the 5, try the 5. If the 5 is too much, go down to 3.5 or 4 milligrams. But nobody can tell you if that's going to be the right number for you because you have to experience that yourself and trust your body and listen to it. If your body says this is good, then stay right there. You know that 5 milligrams from this point on is your dose and not anything else. Nobody can tell you different because keep a journal, write these things down, write down the date, the time you took it, what you took it for, and then note when you finally start to feel the onset. When do these effects start to kick in? Write that down, the time, and then write down how you feel. That'll help you to track it. It's basically like you're becoming your own doctor in a sense. You're learning your body, you're listening to your body. Go back to your notes the next day and like, okay, I did this, I did that. Now you know, like this is what you need to do going forward. But you need to definitely, you got to get into it. You gotta do a little experimentation. It's up to you if you want to go up, but go slow. I think you're going slow. Take notes, pay attention, refer to your notes, and be consistent with that. And I think you'll be okay. Judge risk versus benefit. Sandra really touched on it a lot in the video, but if your benefit is going to outweigh the risk, whatever that risk looks like to you, whether that's social workers being involved, or I don't know what your risk would be. But if the benefit is you feeling well and being able to enjoy your life, if that weighs heavier to you, I would say go with enjoying your life. So next question. Is it okay to smoke flower and or vape while pregnant? Will it affect baby's lungs, or is it best to stick to other consumption methods? Okay, so we did already touch on that, so I don't think we have to spend too much time on this question. If you want to do other consumption methods, it's completely up to you. Where do you live? What do you have access to, right? You're in a legal state, you're able to get gummies, you're able to get tinctures, you're able to get topicals, and you're able to get, you can get a vape if you want. You can buy a dry herb vape online. There are a lot of really good brands that you can use. You don't have to be in a legal state to get that. My only concern if you're living in a state where cannabis is not legal is who's your source? Where are they growing this? Are they using pesticides? There are ways to buy tests at home and you can test your weed yourself. You just need to be very much more mindful than the consumer who lives in a legal state. That's my only concern about smoking weed in states where it's not legal, is the quality of the flower that you're consuming. And for that reason, I usually tell people who don't live in legal states to kind of lay off of smoking while pregnant, because you just don't know your source. And I would just stick to CBD, which you can order from reputable places online, or try to make your own edibles. If you have the time to test the flower that you got from your plug, I would say turn it into edibles, and it'll stretch and it'll make it last longer too. So that's just my little 2 cents to add to that. Okay. So many good questions. Okay. So somebody asks, is it safe to consume during pregnancy? Studies to support it. We already touched on that one. Next question. How did those of you that consumed while pregnant handle the drug test, prescribed drug test? I wasn't given a drug test when I was pregnant for neither one of my pregnancies. I never received a drug test. And if a doctor is drug testing you, they usually should have to get your consent first. If they're drug testing you without your consent, we got problems. So you can definitely maybe call your lawyer, maybe say, you're not going to be my doctor anymore, but they can't do that. Your baby, however, they don't need your consent to touch your baby. But they need your consent first. So if they're giving you a drug test, you can say no. If they're asking you, if they took it behind your back, that's not your doctor anymore. You guys want to add anything on that one? Right. That's not my doctor anymore. Women consume via vapes and edibles. I've been consuming via tincture. How are they different? Does one affect me and my baby more or less? So she's wondering, how are tinctures different from edibles?
I really don't feel like there's that much of a difference. It's both going into the bloodstream. I feel like edibles take a little bit longer for me to feel, but when they hit, they really do give me whatever it is I'm looking for: relaxation, ease of nausea. Tinctures, I feel like they hit really fast depending on, what your milligram is. My preferred way definitely was like a tincture way. Still is. Have them right here with me. So I would recommend, tinctures if anybody is interested in using, and I don't really see the difference.
Yeah, I was going to say that the main difference is that tinctures, when administered sublingually, which means underneath the tongue, it absorbs into your bloodstream, into your body faster. Usually the onset is like 15 to 20 minutes, maybe 30 minutes max. Via an edible, which, think about it, you're eating this, so it's got to go through your whole digestive system. It's got to break down and then distribute gingerly throughout your body. That takes a long time. Like I'll take an edible and I've had some that take 6 hours to kick in. I've had some that kick in 2 hours. So it's being mindful of that. But however, edibles really do relax my body more. It's definitely more of a body feeling for me. So if I'm having body pain, I go for the edible and I'm mindful that it's not going to kick in right away. So I usually layer it. I'll do a tincture and take an edible at the same time. So the tincture is going to kick in right away. And by the time the tincture wears off, the edible kicks in. So being mindful of that, because it's just like taking any other medicine. They say take it every 4 to 6 hours. You should really do that with your cannabis as well, so that you never have a time where you're in pain or you're feeling nauseous or you're feeling depressed or you're feeling anxious or whatever it may be. Because you should stay well. You should stay here at a level of equilibrium at all times. So there are definitely ways. But tinctures just they're going to kick in faster. So our next question says, she says, I kind of want to hit the CBD right as active labor kicks in. Thoughts? And I guess she's assuming like, I don't know, hit the CBD, maybe a CBD. I don't I don't know like how she's hitting the CBD. Maybe she's taking a CBD gummy or tincture or smoking it. I don't know. But do you guys have any thoughts on CBD and labor? I'll be honest, I've had C-sections, so I never really had active labor. I've never experienced contractions. I never experienced Braxton Hicks. I don't know how it's possible, but I never felt pain while pregnant in that way. So I don't even know what labor feels like. So I can't relate. And I don't know what active labor is, to be honest. So.
I mean, yeah, I guess like it depends what form of CBD she's like talking about. But, you like with contractions and back pain, you could be using creams and topicals to, massage that. So, but you could be drinking teas or whatever. Obviously, like what I was saying earlier, is the closer you get to like transition, you don't necessarily want to be that relaxed. Because as like Sandra mentioned with that one mom, like it started to stall because her body was so relaxed. But definitely like during, for like back pain and stuff like that, I don't see why not.
Okay, so we have another question. I'm in Canada, so I'm not super worried about legal ramifications, but I'm also curious if I need to disclose my cannabis use to my primary doctor. My gut says yes, because it's my doctor, but I am also worried about blowback. So we definitely touched on this, and I think we all agree you don't have to tell them shh. Our next question is, pregnant in California with having frequent blood tests, can your THC be tested at any time, or when does testing occur in general? So yeah, if you're pregnant, there have been moms I've spoken to in California who have been drug tested, especially like you mentioned, Shanae, and Kaiser hospitals, especially if you have Kaiser insurance, you need to make sure that you are, dotting your I's and crossing your T's, because they are super anti-weed. So I would definitely, it doesn't matter, even if you are in California. Unfortunately, a lot of the times, all that you have to be is low income or a person of color, Black, and that's enough for them to test you. And they probably won't ask you, especially if you are Black or a person of color or low income, because of racism, right? And capitalism, right? So those are factors that unfortunately I have to say. And I know it's like nobody wants to hear that part, but you need to hear that part, especially if you fall into any of those categories. If you have a certain type of insurance that indicates that you're low income, for them, that's a red flag. So you have to be mindful of how you conduct yourself in those spaces, meaning say no if they ask you, if they do ask you about your consumption. If they still drug test you and they tell you, oh, you tested positive, you say, I didn't consent to that drug test, So just know your rights and be ready to advocate for yourself. I hope I answered that question. And when does testing occur? It can occur at any time if you are Black, brown, or low income. So that's kind of the unfortunate part that I hate. I hate saying, because as a Black woman myself, I still have that concern when I go into doctors' offices and hospitals. Not usually the most welcoming place for us, especially when the maternal mortality rates for Black women. But it's still, still advocate for yourself and just know your rights, and you'll be okay. All right. I think I got all the questions. Oh wait, there's another one here. And I actually looked this up. Is it safe to consume FECO, I think FACO, sublingually or in capsules while pregnant? And I looked that up, and that is I hadn't heard of that. I heard of have any of you guys heard of FICO? It's like full extract canna oil. So it's kind of like RSO, which people say it's like a comparable to that. And she's wondering if she should consume it sublingually, so like underneath the tongue. And I know that people say that with RSO, it is so potent. So I'm wondering, what are you taking it for? Like, do you have chronic pain or something like that you're treating? Because then it's something where, like, again, do the benefits outweigh the risk? If you're dealing with chronic pain, if you've been dealing with it your whole entire life, and this is the only thing that helps you to be well and feel well, then you have to weigh those risks. But I would just always say, be mindful of the dosage, and make note of what dosage is okay. And what you consume when you're not pregnant is not the same as like what you consume when you're pregnant. Okay, I think I got all the questions here. Did you guys have any questions in the chat? Do we have any? I think that you guys, we've been pretty active in the chat, but we've been answering them. But if you guys do have any questions, I know we're supposed to end at 3:00. I'm going to ask the ladies before we started if we could stay on until 3:30 if we need to, if you guys have questions. So if you do, now is the time where you can unmute yourself and ask the question, or you can write it in the chat. Okay, I have a question here. Oh, okay, there's questions. Okay, I have a question that says, does CBD show up in the drug test the same as THC?
I personally did not see the difference, because that was my method of choice after I was told to cut back on the THC, and they never said a thing. So for me, nothing showed up.
And it depends on, like, if you're consuming hemp CBD, there's usually like, I don't know, it's like 0.03% THC, sometimes still present. That is such a tiny, tiny amount. And if they're doing a urine test, I'm going to err on the side of that it probably won't show up, that small amount. But that depends on like your consumption, right? Like, are you smoking a lot of CBD? Are you taking like a large amounts of tincture or edibles? There's so many factors that can come into play, because some people even ask this question when they're working certain professions and they want to know, can they consume CBD and still pass a drug test? Well, it's like, are they doing a follicle, or are they like doing a hair drug test? Is it urine? Is it blood? All those things kind of matter on whether they can pick it up. Your weight, your size, like those things kind of can help decide how it metabolizes in your system and shows up in a test. So there's so many factors at play. But I would err on this side. I mean, I could be wrong, but I would err on the side of saying no, it's not. Like you said, Shanae, because it's so like there's no THC virtually present, and you would have to be consuming so much. I feel like for it to show up. Let's see what else y'all got. What other questions? I saw another one. Hey, I was wondering if anyone who smoked while pregnant noticed a change with their baby's movement. I think I noticed less movement when I'm high. I didn't notice a change. My son was very active. What about you guys?
I feel like I noticed equal amounts. Like there probably were times where like, once I was chill and relaxed, like I've noticed the baby chill and relax, but then there will be like when he wakes up, just active movement. So, but yeah, someone just said I noticed way more movement, but I would say that stands out more to me than the times that they were like chilling. Like I would more so notice all the active movement more than I noticed that they weren't really moving. You're muted, babe.
I think
maybe it's the fact that when you go ahead. Go ahead.
I feel like with me, same thing, like in pregnant, like when you're smoking or however you would consume, I feel like you're more in awareness and your body's more relaxed. So I feel like I would pick up movement or notice it more. Maybe I feel like that was my experience. I didn't really feel like the baby was like zenned out and like chill. I feel like I felt the baby actually move more. And maybe if I'm in not much awareness, the baby is too, maybe because of the cannabis.
Somebody said it's like, damn, I'm really pregnant. That's how it really feels like when you consume. You're like, like you guys know that I was going to say you're more aware. Even when I'm like consuming and not in pregnancy, I'm more aware of my body when I am consuming because I'm just more in tune with myself. I'm paying attention. So yeah, I feel like after I consume, I touch my belly and I'm like, whoa. Like there's things really I'm able to see because some people say I can see the foot through my stomach. I could never with my daughter. I could never really connect that. It was like I can't see anything. And with my son, I don't know if it's because I was paying attention more, it was my second pregnancy, or if it's because I was consuming, but I would be like, oh my God, I saw the body part. And that, I think it's just you're more focused in on your body. Do you guys have any more questions for us? Teas, any tea recommendations? What state are you in, Gabrielle? If you're in California, I recommend Kikoko. I recommend Kikoko. You're in California. It's a woman-owned brand. They have some really dope teas. I love their positivity. That's what it's called, and it is. It has a good amount of THC, but it still has a little bit of CBD in it, and it jumpstarts my day whenever I drink that. They have a sensuality that's supposed to help get you in the mood. And that also has THC in it. And they have a sympathy. They have a tranquility. So they have a good variety of cannabis teas for you to consume. Yep, I'll put the name in chat. Do you guys have any other brands that you like or do you guys make your own?
I don't make my own. I actually just tried tea for the first time, like maybe a couple of months ago. A friend of mine, she makes it and came to my son's birthday party and she had gave me some, but they were really good. And I would put a little bit into Harley's milk and that would just help him all the time. He would sleep amazing after that and just seemed really relaxed. So I definitely want to order some more tea. So I would love, that's why I wanted you to put it in the chat. Thank you.
Yes. I recommend it to everybody, and like on the low, I try to give it to all my friends, even if they don't live in California, because it's just it's good, especially for people who don't like to smoke or don't want to smoke cannabis. Tea is a great way to introduce it to them, because almost everybody drinks tea. Someone else asked, how does THC affect breast milk, if at all? I think you answered that, Hannah. Hannah said that.
Yes, it's like very insignificant, the amount of THC that actually transfers into breast milk. So basically, like your body absorbs most of it, and then your baby gets like it's like 0.0, maybe another zero something. So it's like very insignificant for the baby if you're breastfeeding.
Yeah, it's like nanoscopic, nano, very like nano amounts, like the smallest of small traces that, and naturally breast milk has cannabinoids anyways. So your baby's going to get cannabinoids regardless whether you're consuming cannabis or not. And consuming cannabis, because there's so much fat in the breast milk, the THC is able to kind of attach and stick to that. I've talked to so many professionals about this. I've now like absorbed the knowledge from them. And so I know, but yeah, and it sticks to your fat. And so it's going to transfer, but it's going to be super small amounts, like not even noteworthy enough. And that's what the research shows. They show that it does make it to the baby, but super, super small traces. I have a question. You probably covered this, but I had to come in late. Oh no. How does THC affect breast milk since breast milk is fatty? Do you mean like as far as taste, or what do you mean? How does it affect breast milk? Do you mean like supply wise, or I'll have to wait for her? Well, oh, she said we answered her already. Never mind. Okay. Does anyone else have any questions for us? Feel free to unmute yourself if you want. If you can't, tell me that too, and I'll unmute you for you.
That I can't figure out how to type. So my biggest concern about eating edibles, so I've eaten edibles consistently for like 12 years as my only form of medicine. But when I found out I was pregnant, I stopped because someone said, what you eat, the baby eats. So my question, I guess, is if you're activating the baby's endocannabinoid system during pregnancy, did anyone notice any negative effects of them not having it activated as much after? Like, I know you said you're putting CBD on gums and stuff, but I don't know how to ask that really. Yeah.
I don't think there's too many negative effects at all, if there's even any, especially since what I've seen. I think you just need to be kind of mindful of the doses that you are using. And obviously, you wouldn't go at a high dose. I felt like when you're pregnant and consuming, you definitely automatically do that and just kind of half each dose. I would say, like, for me, I would just kind of cut everything in half. I feel like a whole joint, cut it in half, spread things out. So it's kind of just, I would say, if there was any negative effects, I'm pretty sure we would hear more about it. And I feel like I don't even hear any negative effects, side effects at all. Like, they just tell you, don't do it. You should not do it. But there's nothing behind it. There's nothing that you see that has affected a baby. So, it's always just trusting your intuition too. It's like, you can't say that more than enough. Like, gotta trust.
Yeah, I totally agree. Like, mama knows best at the end of the day. I don't know why my thing isn't turning to active speaker. I don't know. But at the end of the day, it really is mama knows best, and trust your intuition as a woman and as a mom, and you will be okay. Like, you know what's best. You're not going to overdo it. I think that we've like moved so far away in society from just trusting ourselves and listening to ourselves. We always need to like be co-signed by a steady or some sort of expert or professional, but nobody's the expert of you and your kids more than you. And nobody knows your bodies and your allergies. Like when you go to the doctor literally asks you like, what are your allergies? What's your blood type? What's this? What's that? What's your diet? Because they don't know that. You're supposed to know that about you. So mama knows best. Always. Do you guys have any more questions for us, or we can wrap it up? This has been so much fun.
Can you hear me?
Yes, I can hear you.
Hey, so first of all, thank you for this. This was great. I'm a smoker. I'm a veteran. And so we are already dealing with the stigma of smoking weed and self-soothing. They don't care about alcohol and people committing suicide and all that, but they care about weed. So that's a whole nother story. But so I just, as far as the teas, thank you for that. I was just going to ask. So I have Kiko in my cabinet right now, but I didn't use it because they said the licorice root, something about that. Did you hear about that? Or they saying licorice root it's not good for the pregnancy. Before I didn't drink it, but I mean, you seem fine. So
I've never heard anything about licorice root being bad for pregnancy. Have you guys heard anything about that? Hannah, have you heard anything about that?
No, I haven't. That's not one that sticks out to me, but you might want to ask an herbalist because I'm not really sure either, or do an extensive Google search to find out because I'm not sure either.
Okay, sounds good. Thank you.
Yeah, an herbalist is definitely like, we're going back to like the old ways, you guys. Like if you're wondering about herbs, find an herbalist. If you're wondering about like holistic medicine, find a holistic medical professional. Like you can find these people hopefully in your area through a quick Google search, and obviously vet them, make sure they are who they say they are, check their credentials and stuff like that. But once you have that aside and you feel confident in their advice, there you go. Does anyone else have a question for us? Well, y'all, this has been so dope. I really appreciate everyone for coming by and spending your Sunday afternoon here talking about pregnancy and cannabis, such a sexy topic. But no, seriously, it's so important. And, however you decide to, I don't know why it's not showing my face. I'm so bothered. Can you guys see me, or am I like not the active speaker?
You are the active speaker. I
am?
Yes, your video is the biggest.
Oh, dang. So why can't I see it myself? That's so weird. Anyways, thank you. So yeah, you guys, this has been so wonderful. However you do decide to consume cannabis, if you even decide to do so at all, it's completely up to you at the end of the day. And I think the only person who could really rightfully object is the person who genetic material is half of that baby. Otherwise, you have to trust you. Mama knows best. Trust your intuition. Listen to your body. You are the expert of you. Get a journal. Get a dry herb vaporizer. Get some CBD bath bombs. Get some topicals. And take care of yourself. Take care of your body, because when you're happy and healthy, so is your baby. When you're not good, your baby's going to know it. That vibe is going to go over to your baby, and then you're going to have a baby who's not good. So if you're happy, what do they say? Happy wife, happy life, happy mama, happy everything else. Like, if I'm good, then I know my kids are good. So just take care of yourself first. And Thank you guys so much for joining me. Thank you so much to Hannah. Thank you so much to Shanae. Thank you so much to Tunisia. Thank you so much to Gabby. Thank you so much to Sandra. Thank you so much to my sister, Shaq. You guys all made this wonderful workshop possible. This has been so much fun. I am so excited that we got to get this information out there and share our stories, if anything else, so that other women can feel like they are not alone because they consume cannabis. You're absolutely not. You're not a bad mom. If you want to keep it to yourself, that's your right. It's really nobody's business, honestly, at the end of the day. And do what's best for you. Do you guys want to have any parting words and let folks know how they can reach you?
I just wanted to say thank you, Shanitria, for inviting me on. This has been super fun. I'll go ahead and just put my Instagram in my bio. My bio in the chat box. You guys could follow me on my page. I'm just, all I really post about is just me and my authentic self. There's really not one niche that I fall into. I just like to share me, myself, my journey, and my truth. And thank you again, ladies.
Thank you, Shanitria, for hosting this. This was something even for us that we got to learn. I was educated by watching Sandra's video and learning certain things. And I feel like we all even benefited from this workshop. So we appreciate you hosting and inviting us on to share our story. And you can find Gabby and myself at Moms Who Cannabis. I will as well put it in the chat. And I think the other two ladies sharing space with you guys and being able to understand and hear your guys' stories. I like that we all got to mesh.
I just wanted to say thank you. And I loved getting everybody's different views on everything. And I learned a lot, even with the video that we watched. So the questions were great. And I also just love that we can all have this platform and come as a community on something that we all agree upon and can gain knowledge from each and every one of us. So thank you for this again.
Yes, I echo what everybody said. And I hope anybody who is thinking about consuming cannabis while pregnant thinks about it and thinks about it more and does it if it feels good for you. Wishing everybody a great rest of their Sunday.
Thank you so much. You guys don't forget to drop in the chat how they can reach you or follow you on Instagram. This has been so wonderful. Ooh, it's really a happy Sunday. I'm about to go take a nap because it's nap time for my 2-year-old. So mama likes to nap when the toddler naps. So thank you guys so much for joining. Have a great rest of your Sunday. Moms who smoke weed are not bad moms. Bye, you guys.